Hello everyone, welcome to Rise IS. I am Alok Bardhan and in today's deep analysis session, we will discuss a very important article from today's The Hindu newspaper on India's public health policy. So, title of today's article is Reconnect Public Health with People's Need. So, this article discussed mainly problem of universal health coverage and what are the key shortcomings of Ayushman Bharat Health and Wellness Center and Ayushman Bharat Health Policy and shifting of goal about health and wellness and what is the approach of government to tackle such issue and key proposals or key factors of Ayushman Bharat Digital Health Mission and factor behind inadequate access of care. So please read this article. This article is very much relevant for GS2 men's health section and we have chosen this article mainly because UPSC in 2015 mains exam GS2 paper asked a question on about public health and universal health coverage. So the question was, public health system has limitation in providing universal health coverage. Do you think that the private sector could help in bridging the gap? What other viable alternative would you suggest? So the question is about limitation of universal health coverage and do you think private sector participation can bridge this gap and what are other viable alternatives you can suggest? So now let's start our discussion, today's discussion with context of this article. So recent health policy which aim to achieve universal health coverage is facing criticism mainly due to rising private healthcare cost, weak public health care quality and excessive focus on individual wellness. So due to rising private healthcare cost, weak public healthcare quality, and excessive focus on individual wellness, recent health policy, which focus on universal health coverage, is facing criticism. So the whole debate is centered around Ayushman Bharat Health and Wellness Center and Ayushman Bharat Digital Health Mission. So Ayushman Bharat Health and Wellness Center and Ayushman Bharat Digital Health Mission is under severe criticism due to neglect of universal health coverage and shifting its goal. Now, let's see what are the key issues. So, see key issues around Ayushman Bharat Health and Wellness Center. So, as you know, health sub center, primary health center, and community health center were rebranded as health and wellness center. So, earlier earlier health sub center, primary health center, and community health center were existed as an individual identity, but now all three clubbed into health and wellness center. So now critics argue that these shifted focus from measurable population health outcome to subjective individual wellness. So recent change of government focus on from measurable population health outcome to subjective individual wellness is another key issue in this policy. And this created ambiguity regarding the role of three-tier healthcare system. As you know, three-tier healthcare system existed from several years, but now the combination of this clubbing of these three-tiered healthcare system into health and wellness center create ambiguity. Now let's see about Ayushman Bharat Digital Health Mission. So Ayushman Bharat Digital Health Mission is a scheme which create digital health record through Ayushman Bharat Health account. So through Ayushman Bharat Health account, government trying to create a digital health record and which maps health facilities and healthcare professional digitally. So through this government can map health facility and healthcare professional digitally. So however, digital database alone cannot solve inadequate physical access to affordable healthcare. So this digital infrastructure cannot solve the problem of inadequate physical access and affordable healthcare. Lack of, for example, lack of doctors. These issues can be resolved through resolving the issue of lack of doctor, upgrading healthcare infrastructure and building new greenfield hospitals, and and bringing new and innovative technology in healthcare sector. So now let's see importance of evidence-based public health. So, evidence-based public health supports universal health coverage, and this also helps realize India's demographic dividend through healthier human capital. So, evidence-based healthcare helps to realize India's demographic dividend through healthier human capital and addresses social determinants such as nutrition, sanitation, drinking water, and emergency care. So, this also can address the social determinants like nutrition, sanitation, drinking water, and emergency care. This also enables and measures through quantifiable health indicators. So, through quantifiable health indicator, government can measure and evaluate performance of healthcare sector. And evidence-based public health reduces dependence on expensive private healthcare. So, now let's see some major challenges of evidence-based healthcare. So, evidence-based healthcare focus on subjective wellness instead of measurable health outcome. So, and another such challenge is weakening of traditional three-tier healthcare system which created ambiguity in healthcare sector. Now, poor physical healthcare infrastructure and despite digital expansion is another major challenges of evidence-based healthcare. Now, rising unaffordability of private healthcare, which create a rift between and creates a gap between haves and haves not, is another major challenge. And fragmented healthcare delivery and information silos is another one such major challenge. And the last major sub challenge is limited justification of high spending on digital platform without corresponding service delivery improvement. So we can get or we can improve digital footprint or digital record, but ground level infrastructure or doctor to patient ratio improvement is very mandatory. So digital record taking is okay, but you need for more efficient doctors training, you need lot of recruitment of doctors and distributions of doctor or posting of doctor in rural areas and improvement in healthcare infrastructure and opening of new greenfield hospitals. Now let's see way forward. How to tackle these challenges? Strengthen health sub-centers such as primary healthcare center and community health center. So, and next way is prioritize affordable curative healthcare alongside preventive care. So, we must also focus on curative healthcare alongside preventive care. Use measurable population health indicator. So, with existing measurable population health indicator, we can also improve the current health scenario and address social, economic, and environmental determinant of health. And next way forward is integrate Ayushman Bharat digital health mission data with actual healthcare delivery system and ensure evidence-based policy foundation and implementation. To conclude with, we can say achieving universal health coverage requires a strengthening of three-tier public healthcare system and addressing social determinant of health and integrative digital initiative with quality healthcare delivery and sustainable health outcome. which depends on evidence-based policy rather than solely focus on individual wellness. So, our team has created a question which is very much relevant for upcoming men's examination. So, the question is critically evaluate the impact of Ayushman Bharat Health and Wellness Center and the Ayushman Bharat Digital Health Mission on achieving universal health coverage. So these are the important keyword, and please try to address these keywords in your answer writing so that you can boost your answer writing preparation. And thank you for attending today's session. You can download complete PDF from our website, and for further preparation, please visit our YouTube channel and our website. Thank you.